Good evening, everybody. I am Dr. Satyam Chakravarti and I am associated with Fortis Hospitals, Kolkata, and I am a practicing endocrinologist over there. So, today I will be discussing about few points about a very common condition, that is hypothyroidism. Hypothyroidism is extremely prevalent. Uh, there may be a lot of reasons behind it, but we do not usually go behind the reasons why hypothyroidism occurs. There are many viral infections which destroy the thyroid gland, or maybe some endocrine disruptors which like soya esters, phytoestrogens, which are usually common contaminant in the usual normal vegetables which we eat, which are treated with pesticides. They might have a role in the causation of hypothyroidism, although it is not very clear. What is more important is we need to understand what happens, what are the basic symptoms of hypothyroidism. Basically, we need to understand that in adults, hypothyroidism may be totally asymptomatic. Only sometimes a mild increase in body weight, lethargy, dryness of the skin, hair loss. These may be the most common symptoms as far as hypothyroidism is concerned. But more importantly, we need to understand that in children, the scenario might not be so subtle. So, in children, what happens? A child who is in his or her growing phase, we need to understand that thyroid hormone is the most important hormone responsible for growth in a growing child, particularly from about 2 to 10 years of age. So, this hormone is extremely important. So, what happens is, suddenly if a child develops hypothyroidism, what happens is the child becomes stunted, there is height loss. How we will see? The parents will complain that my child is not growing as per his or her peers. This is one of the important symptom, that everybody in the classroom is taller than my child. That is one important point. Other is the child may grow lethargic, there will be inalertness, there might be inattention, loss of attention, poor academic status of the child, gradually deteriorating academic status of the child. So, these might point to the child having hypothyroidism, which is primarily known as juvenile hypothyroidism. And here what we need to do, just a thyroid function test, and if we find that yes, there is overt hypothyroidism, we need to supplement the child with thyroid hormones, and that will cure the condition. But we need to understand that the thyroid hormone supplementation is usually lifelong. That is one most important thing, because a thyroid gland which is not optimally functioning, except in rarity of cases, they will recover by itself. Otherwise, it is the loss is permanent, and we need only to supplement the thyroid hormone. Unusual scenario, but might be quite dangerous, which is seen, is that in rural background there might be children who suddenly crop up to a physician, or we have a lot of medical helpers, medical health professionals. These parents take the child to those healthcare professionals because the child is not growing, and thinking that something is abnormal in the brain, an MR scan is done. And what happens is that the problem is, we need to understand, when the thyroid hormone is not optimal, the TSH, a hormone secreted by the pituitary gland, that is raised, and raised above, much above the normal levels. And when the pituitary gland has to produce a lot of TSH, thyroid stimulating hormone, what happens is it in turn enlarges in size. So, which simulates a pituitary tumor. Now, it is not a pituitary tumor, it is just the enlargement of the pituitary. Parents, even we healthcare professionals sometimes get foxed by this scenario and think that this is a pituitary tumor, and in rare chances these children might get operated, which is extremely not unwanted scenario. So, here we need to understand, whenever a child is not gaining height properly, the child is lethargic, not performing well, a thyroid hormone function is extremely important. Only a thyroid hormone function to detect hypothyroidism which will solve the entire issue with 50 pice tablet per day. So, this is one important point, and when thyroid hormone supplementation is done, a regular question is what is the exact method in which the thyroid hormone supplementation is to be administered. So, we need to understand that it is administered in empty stomach, we all know about that. What is more important is that one, it should be taken early in the morning, the first thing to be taken in empty stomach. After that, at least 40 minutes to 1 hour, except water, you should not consume any other foodstuffs. More importantly, any other medicine which might be taken in an empty stomach, like antacids, medicines for dyspepsia, these medicines should not be taken alongside levothyroxine hormone, because they will jeopardize the functioning of the levothyroxine hormone and will cause inadequate absorption. So, everything to be taken should be taken 1 hour after, at least 1 hour after taking the levothyroxine hormone. If you forget to take the levothyroxine hormone, the only thing is there is nothing to worry, take 2 tablets the next day. And the last thing we need to understand about when a patient is on levothyroxine supplementation, we need to avoid soya preparations, particularly there are households who use refined oil, soybean oil. If you regularly use soybean oil, this will interfere with absorption of this levothyroxine, and what happens is that you will not get a normal TSH even after regularly taking the thyroid hormone supplementation. That is one important. Any other things, any other goitrogens like suppose cabbage, then soybeans, they can well be accepted, will be consumed in the afternoon, but not in the morning or the night. So, I do not think we need to know more anything about that. So, hypothyroidism overall, if we have this general perception, it will do a lot of good to the community. Thank you.